iHeart, Spotify, and other popular podcast channels. And now, your university professor, published author, and U.S. Army Airborne Ranger veteran, Dr. Aaron Bryant.
Welcome to another episode of Dr. Bryant Speaks. I am your host, Dr. Bryant. As I always tell you all, you can call me Aaron. I want to thank you all for your comments, your emails. I cannot express enough how much I appreciate the feedback, the Instagram likes, the followers, the subscribers on YouTube. I mean, you guys have been absolutely amazing. I really appreciate the direct contact on the emails. I mean, the things that you say and recommend. And most important, I truly appreciate when some of the topics that we cover actually have an impact on you as a listener. I put a lot of work and a lot of research into the things that we cover. I just don't randomly come on here and just start jabbing about things because it sounds cool. I truly put in the time, put in the work to give you guys the information that's relative, necessary, and most importantly, things that actually will make a difference to those of you out there. It's important that we work together, that we collaborate. I bring on speakers that are experts. Sometimes they're available, sometimes they're not. Sometimes they just give me feedback. But we're on so many podcast channels that we must be doing something right. I mean, we have Podcast Index, Deezer, iHeart, Spotify, iTunes. I mean, it's amazing how we just been picked up over and over and is starting to really get out there. And that's because of you. So I want to thank you. Because of you, we're actually achieving a lot and we're making a big difference. So thank you. So moving on, now that we've given all the gratitude out there, let's get into some other things. Now, because the show is growing, we're actually getting a lot of support. Okay, so on this show, you guys know, my returning listeners, you know what this is all about. But sometimes we have new listeners that are actually listening because of referral or they stumbled upon what we talk about, and that's mental health. Now, in the beginning, some of my earlier shows, we primarily focusing on the veterans, but we've expanded our topics because what we discuss is so important. It crosses over not just military, but law enforcement. I mean, we have so many relatively close things in common that this is not just about our veterans. We got active duty military, active duty law enforcement, fire departments, basically first responders, and then we have just everyday people who are suffering from mental health. So any such person that is listening and is out there, if you're having challenges, you're welcome to listen to this show, take on the advice, and please feel free to reach out and let's have a conversation. So on that note, this show is a continuation of one of the previous shows, which was actually titled Suicide. Now, on that show, we discussed mostly the data behind suicide. I really wanted to expose the information as it related to such a problem that we're experiencing worldwide. But more importantly, it's really trying to bring the exposure to let people understand that, one, they're not alone, but what can we do? But last show was just kind of shaking things up and saying, look, this is a problem. This is an issue. And I've gotten some emails and comments about that. So much that I had to do a follow-up show because we can't just stop there. Remember the background behind this show. I am trying to do my part. And it's because of so much information and so many people who are looking for information and they cannot quite get to everything. This show is doing its best to bring that information to you. So again, the first show really just talked about the data. This show, we're going to dive in a little bit more and try to bring some things close to home. Now, you know, I'm a veteran. I'm a military veteran, and I am not a psychiatrist. Yes, I have the doctor in front of my name. However, there are so many different categories of being a doctor, and psychiatry is not one of them. I do have a minor in behavioral science back in school, but I am not somebody who can prescribe meds, and I'm definitely not going to have you sitting on my couch giving me your information. Now, that doesn't mean I cannot be a listening ear, provide you some guidance, and help you through this, and which is really the essence behind this podcast. I do have enough insight personally, and that insight gives me enough information to provide you some guidance. And because I have a relative understanding of what you, if you're actually suffering from this possible circumstance, I can understand and I can relate. But more importantly, I want to make sure that we can help you understand if you have a relative, a child, a friend, if it's yourself, let's talk about it. Maybe you don't even know, you're not quite there yet. So we're going to look into this and we're going to kind of understand a little bit more of what suicide is all about, so we can really try to focus on helping a friend, a family member, or even yourself. Now, I said I have relative understanding. Now, let me talk about why I said that. Everybody is different. We are all different. We have all different backgrounds. We have different upbringings. Culturally, we are different. We have different genetics. There are so many things that make you different from me. Our only common denominator is possibly because you're a male, a female, LGBTQ plus. Hey, that all still brings us back to being a person. But as a person, we have our own experiences. Now, the interesting thing about mental health is your experiences does tie into what you could be struggling with. Now, that might be something new for you to understand or learn, but trust me, that was something that shocked me too. It wasn't just because I went into the military and then I come out and boom, I have PTSD and I just can self-diagnose, or my therapist can diagnose me and we can pinpoint exactly what I'm dealing with. It's not that simple. Some of the things that I have struggled with or am struggling with ties back to my upbringing, ties back to certain relatives, ties back to things that I've been through pre-military. So I say that because, again, we have to really understand that everybody, although we have a common denominator, we have our own experiences. And that's important to understand, because the truth of the matter is you never know who could be suffering from the possibility of committing suicide. So let's talk about detecting it, because this podcast, this is all about preventive. If we can bring down the numbers, we could be achieving so much in this society. So this show, again, we focus on mental health. Well, the thing is, suicide is not actually a mental illness, according to a lot of the data that I found. Okay, so why am I talking about this on the show if it's not a mental illness? Well, that's because there are so many elements that actually bring somebody to commit suicide that ties into mental illness. That's what's scary. The good news is that it's treatable. You know, although there are mental disorders that will bring somebody to commit suicide, we can actually find ways to treat it. Now, putting back my veteran hat on and understanding a lot about mental illness, although they say we can treat that, it's an ongoing treatment that is deep, deep inside. Whereas if we can kind of find out what is it that's bothering this person to bring them to consider suicide, that word, that operative word, treatable, can actually prevent it. There's a lot of resources out there, and I'll talk more about that later, that actually will give us the guidance of helping somebody through this. Again, I am not your therapist. I am not your psychiatrist, not your psychologist. I am going to give you some tools, some things to think about. I want to bring you to understanding more about yourself so you can maybe tie one and one together and be able to see, maybe, is it a friend, a relative, a loved one? Is it yourself? There might be something I might say that will bring you to that awareness. That is the goal here. Again, I'm bringing you information. What you do with it is up to you. If you share this podcast with somebody, if you feel it's something that's important for them to hear, the most important thing, and we're going to talk about this later, is what happens next. All right. So, some of the treatable mental disorders, it's quite a bit. And again, going back to the elements of why somebody may choose suicide, there are a lot, and we can't tackle them all, and I cannot get in all the details, but there are some highlights there. And I hate to use the word highlight, because we typically use that in more of a positive, description, but there are some high level things to factor. Major depression is one of those. Sometimes people don't always understand that they might be depressed. And again, this is where we come back to friends and family, people that know somebody. Focus on some of that. Is they going through major depression? Is the person diagnosed with bipolar disorder? One of the things I talk about on this show a lot, PTSD, post-traumatic stress disorder. What about borderline personality disorder? Schizophrenia. You also have the fact that somebody could be suffering from substance abuse. That's a disorder. And if they're suffering from that, that can contribute again to them considering suicide. Another disorder is anxiety. Now, a lot of people do not like to talk about this. However, it's pretty rampant especially among women, and that's an eating disorder. So you have bulimia. Let's think about that, the anorexia nervosa, okay? These things are very important, and these all can be elements that will bring somebody to consider suicide. So again, I'm not going to go into the details, but if these are things that somebody could be either diagnosed with, or if you are aware of these particular categories, they could be considered somebody at risk. So pay attention. And I say pay attention, that's going to be the element, that's the essence of this entire show, is because, again, as I said, we have to work together, and we have to make sure that we are in the fight to protect one another. I bring you the information, and what you do with it is up to you. But we have to ensure that we are paying attention. That includes to ourselves. I've mentioned many times on my show how I work with my therapist, I work with my doctors, but again, I have to think about Aaron. And I know my body better than anybody. I'm not smarter than my psychiatrist. I'm not smarter than my psychologist. I'm not smarter than my social worker. I don't think I know more than them in their particular field. So when I'm prescribed a new med, or if my meds are increased, These things I take into consideration. And then I try to listen to my body and pay attention.
Wake up, early mornings, late nights, hopping on a different flight. What's the meaning of life, ayy? Wake up, same-ish, different day. Make a wish, call it pray. Am I sick, am I okay, ayy? Stay up, late night.